Hi, my name is Valley. I'm the head athletic trainer at Motion Ready Performance and Rehabilitation. Today we're going to be talking about ankle sprains. Ankle sprains are one of the most common injuries to occur in sports and physical activity and account for about 30% of all sports medicine clinic visits per year. In addition, they occur at a rate of about 25,000 per day, which amounts to about 9 million per year. So odds are you've either experienced one yourself or you know someone who has. Before we get started on some of the exercises that Motion Ready likes to use to help not only prevent ankle injuries, but also to help you restore function if you've already had one, we're going to take a brief look at the basic anatomy and terminology behind ankle sprains. So before we can begin talking about ankle sprains, you must first understand what the term sprain means. A lot of times you'll hear it used in more of a casual fashion, as in, he just sprained his ankle, he'll be fine, or it's just a sprain. A lot of the times it's kind of diminished in its severity, but it's important to note that a sprain actually denotes different levels of tearing of a ligament. It can be anywhere from some mild stretching all the way to a complete tear. So I'm going to go ahead and draw this for you so you have a better visual representation of what I mean by that. So when you have a grade 1, it's going to look something more like this. Okay? So as you can see, the dark spots here is going to be completely intact. Nothing within the ligament itself is disrupted, but it's going to be a little bit lengthened in certain areas. It might be a little overstretched. Essentially, it was almost to a tear. It almost got pushed far enough, but your body was able to correct it, or you were able to regain your balance before any significant damage occurred. Now, on the other hand, when you have a grade 2, it's going to look something more like this. Okay, so the grade 2, you're going to actually have partial tearing of that ligament. Okay, you can see it doesn't go all the way through, it's a little bit less than 50%, but that means a significant portion of the fibers have been disrupted. So when you have this level of an injury, you're going to have some laxity. Now, laxity simply refers to looseness in the joint. As a healthcare provider, you're going to grab the calcaneus or the heel bone and pull it forward and see if you can get any anterior translation from the calcaneus out of that joint. And if you have that, that would be then considered laxity, just that joint is a little unstable. And with a grade 2 or a partial tear, you're definitely going to have some laxity. You're going to have more bruising, more swelling, more pain. Okay? And then it only gets worse from there. Moving on to grade 3. So with the grade 3, you're going to have a complete tear that goes all the way through the ligament. Okay, that would be a grade 3 complete tear, a rupture of that ligament. So with this, you're obviously going to have a lot of laxity because that ligament is no longer intact at all. It's not even holding that joint in position anymore. You're going to have definitely more swelling, definitely more bruising. You're going to have pain can vary. Sometimes if it tears the nerve endings, you'll have initial pain that's really, really intense, and then the pain from the ligament itself will go down, but you're likely to have a lot of pain and discomfort from the swelling, putting pressure on other structures. But as you can see, there is a huge range between some overstretching to a complete tear. So when you hear someone refer to, them just having a sprain, it's kind of important just to remember what that term actually means, because they could be dealing with a complete tear or a partial tear versus just some stretching. So now that you understand what the term sprain means, we'll go over the basic anatomy and the structures involved with each injury. So to start off, the most common ankle injury is going to be a lateral ankle sprain, okay? And that's going to occur from an inversion mechanism. Now, inversion means your toe is pointed inwards. So essentially, your toe is going to be pointed inwards, and then you're going to kind of roll over your ankle, and you're going to injure these ligaments that run around on the outside here. So on the back side, you have what's called your posterior talofibular ligament, and then running down in the middle, you have your calcaneofibular ligament, and in the front, you have your anterior talofibular ligament. Now, that sounds like a bunch of big words, but all they're really telling you is where that ligament runs. So for example, your calcaneofibular ligament runs from the calcaneus to the fibula. Okay, so it's just giving you an idea of what structures are involved. Now, with the lateral ankle sprain, this occurs about 85% of the time. So its prevalence is overwhelmingly higher than the other two types of ankle injuries. So we'll switch to this foot here so you can see kind of on the inside. So the other ankle injury that can happen is an eversion ankle sprain or a medial ankle sprain, and that's going to damage the structures here on the inside. Now the ligaments here are made up of about 6 different ones, but it's referred to as a deltoid ligament. Now this ankle injury only occurs about 5% of the time, and that is because number one, that ligament is so strong and spans this whole area, and also the makeup of the foot. So if you try and move your foot in, you can see there's a lot more motion, but if you try and go out, you're not going to be able to get as much. And part of that reason is because outside you have your fibula that runs a little bit longer that actually prevents that motion from your foot moving out, versus on the inside you don't have that structure, so it allows for more motion there. And then the last type of ankle injury you can get is a syndesmosis sprain, more commonly referred to as like a high ankle sprain, and that's going to occur between your tibia and your fibula. So you have 2 bones on your lower leg. The outside skinny one is called your fibula, and then this one that you can feel most in the front here, that's your tibia. You have a little membrane that runs between those 2 bones, and that membrane can get disrupted with a bad ankle sprain. Usually still going to be an inversion type mechanism. It's just bad enough to actually disrupt the congruency of those 2 bones. This is going to take a little bit longer to heal because your joint is essentially set up with the talus running in between the tibia and the fibula, so that every time you take a step, it's putting pressure on those 2 bones. So if that structure is damaged, it's obviously going to hurt, and it's going to take a little bit longer to heal. So that occurs about 10% of the time. So 85% of the time it's going to be lateral ankle sprain, about 5% of the time it's going to be medial, and then the rest is going to come from that high ankle sprain. Moving on to the anatomy, which is going to be really important because the exercises, in order to help prevent you from getting an ankle injury or to help you come back from an ankle injury, you're going to have to know what exactly it is that you're trying to target and what they do. So with the number one most common ankle sprain being an inversion ankle sprain, you should think about, okay, what can I do to help resist that inversion or to strengthen so that it doesn't happen as easily? And that's going to come from your peroneals. Okay, your peroneals, you have your peroneus longus, peroneus brevis, peroneus tertius. So you have several muscles, and they come around on the outside, and they run all the way down and connect underneath on the bottom of your foot. Now, the 2 motions that they do is plantar flexion, or pointing your foot down, and eversion, which is pointing your foot out. So as you can see, eversion here is pointing your foot out. You can see these muscles pop out and pointing down. Okay? So eversion is just simply pointing your toes out, plantar flexion, pointing your toes down. Okay? Then on the top side here, you have your tibialis anterior, which is responsible for dorsiflexion and inversion. So with dorsiflexion, you're going to point your toes up towards your nose, all the way up. So as you can see this big muscle pop out here, that would be your tibialis anterior. Right? And then it also does inversion, which is pointing your foot inwards. Alright? Then we'll move over to this leg. On here, you're going to have your tibialis posterior, which runs from about the knee all the way down to behind your medial malleolus here and connects to the bottom of your foot. This muscle does plantar flexion, again, pointing your toes down, and also inversion, pointing your toes in. Okay, and then the last couple you have, you're probably most familiar with the gastrocnemius, which is going to be the big, bulky muscle on the back of your calf, and then underneath that you'll have your soleus, and those both connect to the Achilles tendon, which then connects to your calcaneus or your heel bone. Okay. When talking about ankle injuries, and with them being so common, you may wonder, well, okay, if it's just as simple as strengthening, your evoters, and how come, people don't do that? But, how many people have you ever seen at the gym doing anything besides calf raises? You may see them do both standing and seated calf raises, but you're not really going to see them doing anything to work on dorsiflexion or pointing their toes up, which is important because when you're walking, you need to be able to clear the ground, and if you can't and your toe gets hit, then you're going to be more likely to roll over it and again get that inversion mechanism for an ankle sprain. Likewise, if you don't spend any time focusing on your peroneals or your everters, they're not going to be able to correct, or say you step on somebody's foot and your foot starts to slide, they're not going to be able to pull it back out and correct that motion. Same thing if you step on an uneven surface, they're not going to be able to adjust. So now that you know the basic structure and ligaments about the ankle joint, what are some things that you can do to not only help you prevent ankle injuries, but also to help you restore function if you've already had one? First and foremost, you need to take a look at your ankle range of motion and your mobility. Most of the time, people are going to be lacking dorsiflexion. Again, as you remember, that is when you're pointing your toes up as towards your face. So that can come about for a couple reasons. One, you could be lacking dorsiflexion because you have tight posterior musculature, whether it's coming from the gastroc, the soleus, or the Achilles tendon, or it can be coming from a lack of active range of motion, and we'll go over that after we talk about how to stretch your calves. Most of you are probably familiar with a couple of different techniques, like putting your toe up on the wall and then leaning forward to stretch out those muscles, or getting like into a plank position and then rocking back on your heels, to stretch out your Achilles tendon, your soleus, and your gastroc. But if that's not having a great enough effect for you, one of the things that we like to try is taking a towel, and you're going to put this around your foot. You're going to move your foot into dorsiflexion, so you're going to bring it up as far as you can on your own. And then you're going to put the towel around your ankle. Go ahead and grab the towel. And then you're going to apply a little bit of overpressure to just get a little bit more ankle range of motion there, a little bit more dorsiflexion. And then you're going to hold that stretch for about, 30 seconds. After 30 seconds, you are then going to push into the towel as hard as you can, trying to bring your toe back down to the table while you're resisting it with your hands. So you're going to push and contract for about 10 seconds. After that 10 seconds, then you're going to relax and then bring it back up into dorsiflexion, and again apply that overpressure with the towel. And most of the time you're going to see an increase after even the first set. Then you do that a couple more times. So hold for 30 seconds, push downwards for 10, relax, hold for 30, push for 10, relax, hold for 30. Okay, and this is actually using your body's own stretch reflex mechanism. By causing those muscles to contract and then relax, you also get a reflexive relaxation of those muscles, which allows you to get a little bit further into dorsiflexion. Okay, so couple those with the other stretching techniques that you normally do. And then another great thing that you can do that you may or may not be familiar with is foam rolling. Foam rolling is a great way to help loosen up tight muscles, especially if you run a lot, you jump a lot, and put a lot of stress on your ankle and your calves and your knees. Likely those structures are going to be tight. So most of you are probably familiar with the traditional foam rolling, where you're going to put it on the ground and then you're going to roll back and forth on it. But one thing we like to do is also rotate your leg inward. That way you get that tibialis posterior muscle that we talked about and the inside of the soleus. And then also point your leg outwards so you can actually roll over the peroneals, because those are likely to be tight as well. In addition, if you flip over onto all fours and you put your knees on the foam roller and roll back and forth, then you're going to get the tibialis anterior. That will help loosen that muscle up as well. So once you've worked on your posterior musculature, you could also be lacking dorsiflexion due to what I called earlier a lack of active range of motion. So what that means is you may simply be lacking dorsiflexion because you don't actively dorsiflex on your own, meaning that yes, you do naturally just by walking and jumping and running and sprinting, whatever you're doing, but you're not actively, purposefully strengthening that muscle or trying to increase that range of motion. So if you have a mini band here, which these are, we sell them on our website for $10. They're excellent for upper, lower body, just about everything. But if you have one, it's a really, really easy way to work on dorsiflexion by simply putting it around your foot and then have somebody hold it for you, or put it around a table, or anchor it somewhere so that you can actually move your foot against the resistance. So all you have to do is dorsiflex. So go ahead and bring your toe up, okay, and then relax. Do it about 3 times. Okay, so if you do this, go ahead and relax. 3 sets of 10. What you're just trying to do is get that muscle firing. So you're going to try and bring it up to your face as far as you can, get that muscle firing, and then relax so that you're actually strengthening that muscle, so that in situations where you need to dorsiflex a little bit more, maybe jumping or running on an unstable surface, or with holes in the ground, and you need to be able to adapt more, you need to actively be able to control that range of motion so that your body can actually use it if in need, and that will also help prevent injuries. Now, if you don't have a band, you can simply do ankle pumps. So just point your ankle up and down, as far up as you can go, as far down as you can go. Okay, you're primarily focusing on the way up, but you want to make sure you're going through that full range of motion. Okay, so you can do that 20, 30, 40 times a day, just getting that muscle firing. Okay, another thing you can do for more mobility purposes is to do ABCs. So using your foot to spell out like a huge capital A, capital B, and go through the whole alphabet. That way you're not just getting your dorsiflexor, but also the whole ankle joint is having to move and rotate. And this is going to help for those of you who've already had an ankle injury, to try and get some of that mobility back just by pushing it to go into different motions that you're not going to use on a day-to-day basis. Now, if you do have a band, these are going to be excellent for strengthening both the muscles on the outside that I talked about earlier, the peroneals and the tibialis posterior on the inside, or your everters and inverters. Especially eversion is going to be important because if you remember, I said that 85% of ankle sprains occur from an inversion mechanism and injure the structures on the lateral side. So if your everters are stronger, they're going to be able to resist those inverted forces as you step in a hole, roll over foot, whatever it is. That way it can actually correct it and prevent those ligaments from being damaged. So for eversion or your peroneals, it's as simple as putting it around your foot and then pointing outwards. Okay. And again, you can do 3 sets of 10. You can do this every day. And then same thing going the other way for the inverter muscles. So go ahead and push in. Okay. So same thing, just move that ankle in. Okay. And then if you want to, you can also do plantar flexion. Go ahead and push down. Now, as I said before, your plantar flexors are usually going to be plenty strong. That's what you'll most likely see people at the gym doing, is either seated or standing calf raises, but you're not going to see the other directions strengthen very much. And then just as an example, here's how you would do it on your own if you're holding the band yourself. One other exercise that is really, really good to target your peroneals, and again, if you have one of these bands or if you have a rope or anything that you can put around, it's a little stretchy, that you can put around your feet, and you can do it with shoes on, it doesn't matter. You can do it standing, but seated is going to be better. When your knees are bent, it's going to activate the peroneals a little bit more versus, your hips and other structures might try and get involved when your legs are straight. So when they're bent, you're going to have them around both feet. And then keeping your heels planted, just rotate your feet outwards. Okay. Back in. Okay. So you can do one at a time if you want. So just hold this leg steady and then use one leg to push out. And then do the other leg. Same thing. Or like I said earlier, you can do both. So this is something that you can do, as part of your warm-up. So before if you're a basketball player, a football player, or someone who tends to suffer from ankle sprains, before you go into the gym, grab your band, put it around your feet, do maybe 3 sets of anywhere 10, 12, 15, get those peroneals fired up, and then, go ahead and do the rest of your workout or start your sport. If you don't have any resistance bands or mini bands that you can use to do the 4-way ankle, another simple thing that you can do is simply change the way that you do calf raises. So for example, go ahead and point your toes inwards. All right. And then do your calf raises with your toes pointed in. And then after you do, maybe 3 sets of 10, go ahead and point your toes out. And do another 3 sets of 10 that way. That way you're getting both the structures on the inside and outside, the peroneals and the tibialis posterior, like we talked about earlier. Obviously still going to work on the gastroc and the soleus, but by changing your foot position, you're also going to change what muscles are assisting you in performing that motion. It can be done weighted as well, so whether it's with dumbbells, barbells, anything like that, if you still need to increase your load. You can also do this on the calf raise machine. So go ahead and get into the machine and then point your toes in, do your sets, point your toes out, do your sets, and you can still do regular, of course, but this will just add an extra element to those structures that you need to work on in order to help try and prevent an ankle injury. Okay, another thing that you can do if you don't have any equipment is do some balance training, and that can be as simple as standing on one leg. So start with 15 seconds depending on how your balance is, and then work your way up to 30, 45 to 60 seconds. And if that's too easy for you, then try something like closing your eyes. Closing your eyes is going to take away one of your senses and makes this also a proprioceptive exercise and not just a balance exercise, meaning that your body is no longer able to use vision as a way to adjust to your surroundings. So it's going to be a little bit harder to keep your balance while standing on one leg if you have your eyes closed. So you can, close your eyes, get a blindfold so you don't cheat, depending on who you're working with. But that'll be really good, especially if you're an athlete and you have to run and not look at your feet while you're running. Your foot should be able to adapt to the surfaces. Another thing you can do for fun with your athletes is make it more sport specific. So Drew here is a basketball player, and one thing that he can do to not only work on his balance but also his dribbling skills is to get a tennis ball and dribble while he's balancing on one leg. And from here, once you get the regular dribbling down, then you can progress to dribbling back and forth, switching hands, anything like that. You can also move to, having a medicine ball and going around, weaving between your legs, or anything of that nature. If you have access to any equipment like a Bosu ball or an Eric's pad or any sort of unstable surface, that's another way to elevate or increase the intensity of your balance training. So starting with the Bosu ball, if you balance on one leg, you can start on the squishy side. And as you can see, his foot's moving around, it's having to adjust and adapt to the unstable surface, and that is going to be firing all those muscles that we talked about that control every direction of his foot. Then if you're like Drew here, you can make it even more intense by dribbling while being on the Bosu. You can also use the other side of the Bosu ball, which is a flatter surface, so you're not going to be using as many as the intrinsic muscles on the bottom of your foot. But as you can see how it's shifting back and forth, that is going to be using all those ankle stabilizer muscles. Again, they're working constantly to help control, and you can see even up all the way up from the knee so that his whole body is not rocking from side to side. So I would definitely do both. Try them, see which one is easier for you at first. Start with that, get comfortable with it, and then switch to the other type. So I've instructed Drew to move his body around while on the Bosu so that you guys can kind of see how those muscles are firing in response to keep him stable while moving on an unstable surface. So you can see the peroneals are working their little hearts out, and the gastrocnemius and soleus are going to be fired up as well. You can also do regular exercises like squats on a Bosu ball. I would recommend using the flatter side. That way you don't have to worry about messing up your knee and ankle position as much from having to deal with a rounded surface if using the other side.